Hello, I'm Dr. Patrick Hu, CEO of Moffitt Cancer Center, coming to you from ASCO 2023 in Chicago, Illinois. We're lucky to have Dr. Jhanelle Gray with us, head and chair of the Thoracic Oncology Department at Moffitt Cancer Center. Thanks so much, Dr. Gray, for being with us.
Great, wonderful to be here with you, Dr. Hu. I mean, it's been such an exciting meeting, and we are looking forward to chatting with you. Looking forward to chatting with you today.
Wonderful. Tell us about some of the presentations your group are putting out today in this meeting.
Yeah, absolutely. So we have some of the presentations that we have focus on looking at immunotherapy. And so we have started to do some retrospective real-world analysis in partnership with ASCO, also here through their Cancer Link database, and looking to see what is our basic understanding right now of treatment trends and how do we improve upon those. It's really exciting.
What else is here at ASCO that's exciting for lung cancer?
Yeah, so we're really excited about the data in the neoadjuvant space and the perioperative space. We saw some great presentations in the oral abstract session for lung cancer. One of them was looking at Keynote 671, which showed an improvement in event-free survival for patients who received perioperative chemotherapy and immunotherapy, going to surgery, and then followed by receiving more immunotherapy. So I think this is definitely a new therapy that is an addition to what we already have for patients in clinic. We're going to have some great discussions with our patients when we get back into town. We also are just right now, the plenary is about to start, and and the data that's going to be presented on the ADAURA study. Again, looking at early stage lung cancer and looking at those patients whose tumor harbors an EGFR mutation. We know from the press release and from the abstract that was released early, now we know that adding osimertinib after surgery can improve your overall survival. So we look forward to seeing those exciting results.
Great, so some really excitement in lung cancer, both on the immunotherapy stage to stimulate the body's immune system, as well as targeted agents.
Absolutely.
For patients with certain mutations in
yes,
cancers.
Absolutely. And I think that also speaks to why molecular testing and doing NGS testing on patients across the spectrum for non-small cell lung cancer, not just for our stage 4 patients, is to make sure that we can identify those patients whose tumors harbor a driver mutation and get them a targeted therapy where it's appropriate. And those who do not harbor a driver mutation is really to then prioritize that immune checkpoint blockade.
Makes a lot of sense. And I know
Absolutely.
every lung cancer patient at Moffitt Cancer Center is molecularly typed.
It is.
Across the country, though, not all patients are typed,
No,
right?
it's really unfortunate, actually. And so we have an initiative where we're working in partnership with other cancer centers, as well as with the community, to ensure that we can get molecular testing deployed, not just to some of our patients, but to all. This is really something critical that we have to do together. Also, this is a big initiative. You know, I sit on the board for the IASSC. This is a big initiative that they're doing a kickoff meeting today with a lot of vendors and a lot of pharmaceutical companies. We all have to come together and move the field forward to really drive impact for our patients.
Well, thanks so much for being here today, Dr. Jhanelle Gray, lung cancer expert at Moffitt Cancer Center.